Come in.
Hi, my name's Megan. I'm going to be the nurse doing your health history today.
Hi.
And your name is?
SJ.
SJ. Nice to meet you.
Nice to meet you.
So our health history, why we do it is just to form a basis for why you're here visiting us today, and just to give us a baseline for what our problems are so that we can properly give you the care that you need. If you have any allergies or anything like that, we're going to cover that today so that we don't have any conflicting procedures, and it'll just kind of give us an insight into your health.
Okay.
And, so hopefully we can help you out with things, okay?
Alright.
Alright, so you said your name was SJ. Okay, SJ, and what brings you in today?
I actually have had endometriosis since I was 15, and lately it's been getting worse. I feel while I have my periods. So I came in to see what else I could do. I'm actually considering a hysterectomy, but I'm not sure if that's the best way to go about it as of right now, or if that is the best way.
Okay. And your real fast, I'm just going to get some basic information from you. Your date of birth.
It is February 2nd, 1985.
Okay, and that makes you 30 years old.
Yes.
Okay, and your ethnicity.
Hispanic.
And your religion.
Catholic.
Okay, and what do you do as an occupation?
Well, I was actually working before, but now I'm unemployed due to all the absences I've had because of the pain that I've been in.
Alright. Okay, and do you have any allergies? No. Okay. Any family history of heart disease, diabetes, cancer?
No.
No. Arthritis, kidney disease?
No.
Have any mental health disorders like depression, anything like that? Nothing. Awesome. Okay, and do you have any birthmarks?
I do.
And have they changed recently, like any color, size?
No.
No.
They're the same.
Beautiful. Any rashes or bruising?
No.
No. Okay. And then, do you have any history of headaches?
Lately I've been getting them a little bit more just due to the lack of sleep because of the pain I've been in.
Okay, so you can't sleep because of the pain, and that's what's causing the headaches, is the lack of sleep. Okay. All right, and any dizziness?
No.
No. No head injuries?
No.
Good. All right. No vision problems?
No.
Any earaches, ear problems, or infections?
No.
Nothing of the sort. Okay. And you had mentioned the hysterectomy and how you're not quite sure about it. Is that causing any emotions?
Yes, it is. I'm actually, well, lately I have never been diagnosed with depression, but I feel depressed lately because of just the fact of not being able to have children.
Okay. If you get the hysterectomy.
Correct.
Okay. Just to let you know, there are other things that we could probably try first, like a certain procedure where they're actually going to take out as much of the endometriosis as they can to properly aid in that. So, I mean,
Good news.
it is good news just to talk to the doctor about possibly. So, any hearing problems?
No.
No, you don't seem like it. Everything's pretty clear here. Any histories of seizures, any brain injuries, spinal injuries?
No.
Nothing. Wonderful. And any problems walking? Do you have to use a cane or anything?
No.
Wonderful. Okay. As far as circulation and everything goes, do you ever get numbness, tingling, anything turning blue, cold, no temperature changes?
No.
Okay. Any heart pain, shortness of breath? Nothing like that?
No.
Okay. And you said no shortness of breath, but is there any pain when you're breathing? pain while breathing? Do you cough? Do you cough? You don't have asthma?
No.
Okay. Do you smoke?
No.
Okay. And could you just explain to me what your diet would look like for one day, like normally?
Well, normally I do not eat breakfast. I just have coffee in the mornings, maybe with a pastry. And for lunch, I tend to have leftovers, or I might stop at a Panera and have some salad. And then for dinner, I try to have a vegetable, a meat, and a starch, but that's pretty much it.
Okay. And how about alcohol use? Do you use any alcohol?
I do occasionally, but normally on weekends I tend to drink maybe a couple glasses.
A couple glasses, okay. So would you call it maybe like 3 drinks a week?
Well, maybe about 6 drinks total during the weekend from Friday to Sunday.
Okay. Got a partier, huh? Okay. And do you have any problems with bowel movements?
I do have constipation here and there, so I tend to take laxatives when needed. I try not to though, just because I know they're not healthy and I don't want to have to depend on them. But
Sure.
if I do need them, I will.
And constipation is actually a symptom of endometriosis, so just so you know that. And your last bowel movement, when was that?
Yesterday.
It was yesterday. Okay. And was it formed? Was it watery?
It was formed.
Formed, okay. And do you ever notice discoloration, like odd colors or blood in your bowels?
Sometimes I notice blood just from being so constipated. I think it's just
Okay.
pushing, but
Okay. And as far as urinating goes, do you have any problems with urinating?
I do have pain
Do you have pain?
sometimes.
Okay. And if you were to rate that pain for me on a scale of 0 to 10, what would you call
It's
it?
about a 4.
Okay. And then, is it a burning pain, a dull pain, aching pain?
It burns.
It's a burning pain. Okay. All right. And when was your last menstrual period?
About a week ago.
About a week ago. Let's see, today's the 17th, so the 10th. And obviously, you have endometriosis. Was it painful or like much worse? If you could rate the pain for me.
It was painful. Normally the first day isn't as bad, but as my period progresses, it gets to about a 10.
Gets to about a 10 out of 10.
Right, and then as it starts to slow down, it's on a good day, it's about a 7.
Okay. Okay. And does it usually last all day long?
Yes, for the most part it
Okay.
does.
It lasts all day long. And does anything help it relieve it?
I'll take ibuprofen and it helps it a little bit, but not
Okay.
fully.
Any exercise help or?
No, it makes it worse, I feel.
Okay. And are you on birth control?
Yes, I do.
Okay. Do you perform breast self-examinations?
I try
You
to.
try to? Okay. Nothing abnormal that you found?
No.
Okay. And when was your last OBGYN checkup?
It was about a year ago.
All right. And are you sexually active?
Yes.
Okay. And because of the endometriosis, is it painful or is that not effective?
It is painful.
It's
So I
painful.
tend not to. I would like to do it more often, but because of the pain,
Okay. And are you married or?
I am not married, but I am seeing someone.
Okay. you guys practice safe sex?
Yes.
Wonderful. And if you were to rate your pain for me from 0 to 10 while you're having sex, what would that be?
It's about a 7.
It's about a 7. And is it a stabbing pain or is it dull, achy, throbbing?
It's more stabbing.
Stabbing. Does anything help it while it's happening?
Not quite. If anything, probably have him go maybe a little slower, but
Okay.
not so much.
And just from my knowledge, if I have to teach you other things regarding your care here, what type of learner would you say you are? Would you say you're a visual learner, an auditory learner, or an kinesthetic learner?
I'm more of a visual and kinesthetic learner.
Okay. And what's your educational level, if you don't mind me asking?
I have some college.
And do you have a healthy relationship with your family?
I do.
Okay. And then, what are the medications that you are taking?
Well, like I said, I mentioned I'm on birth control, and I do take ibuprofen as needed for my headaches along with endometriosis.
Okay. And do you know what birth control you are on?
Yes.
Okay. You might want to have your OBGYN next time you're there take a look into that, just because Yaz isn't very good with blood clots, and with endometriosis we just want to make sure that nothing else is blocking it out.
Okay.
Okay.
Thank you.
And then today's weight?
I think I'm about 160.
Okay. And then yesterday's weight?
Maybe about
Weight yourself?
Maybe about 159.
Okay. Just fluctuations here and there. Okay. So just a quick overview before we're on our way here. You're coming in because of your endometriosis getting worse, and you're considering a hysterectomy because the pain is becoming unbearable during those weeks of your menstrual cycle. You're unemployed now because of your absence relating to that endometriosis. I'm sorry to hear about that. No changes in any skin, birthmarks, rashes. You do have some headaches now just because of the lack of sleep from the endometriosis. You're having some sadness related to the hysterectomy, maybe causing infertility because you do want to have children someday.
Correct.
Maybe 6 drinks a week, okay, and mostly on the weekends. Sometimes bloody stools with malformations are good.
I wouldn't say that they're bloody, but I'm just saying maybe when I wipe, just because they're so hard, it hurts.
Okay. So the stretching produces.
Right.
Okay. Thanks for clarifying that.
You're welcome.
And so, but you do have the constipation from the endometriosis sometimes, but you try to stay away from laxatives, but sometimes you do use them. You skip breakfast, which isn't good. It's the most important meal of the day. Painful urination on a scale of 0 to 10, you just called it a 4. It's a burning pain. Your last menstrual period was a week ago. It is very painful. At the beginning, you said at the best, it's at a 7 out of 10. At the worst, a 10 out of 10. I didn't ask you now, since you're not on your period, has it subsided? Is it like
Yeah,
at a
right
0?
now it's at 0.
Okay, that's good. And you are on birth control. You do try and perform your breast exams monthly. You should probably get back to the OBGYN. It has been a year, and you're sexually active, but it is painful. But you guys do practice safe sex, which is good. As far as safety goods, we're good. And then you're a visual and kinesthetic learner, and you're taking ibuprofen and the gas.
Yes.
Okay. Well, that's about sums it up. I'm going to get this put into our electronic medical records just so that the nurses taking care of you while you're at your stay here can properly make sure that they have your history on file so that they know what's going on and what we should be doing to properly help you out with your stay here, okay?
Okay.
All right.
Thank you very much.
Thank you so
It
much.
was nice meeting